Oh my God, this nurse is not the nicest person. So I'm just here with her, waiting for her to get called to see the anesthesiologist, and then we'll take it from there. She's having foot surgery.
Hi everyone, welcome back to Lisette's channel. I know normally Lisette does all the talking, but today she allowed me to present this video. This video is going to be about bunion surgery removal because that's what I had on my right foot. I have bunions on both of my feet, but no longer on my right foot, so just on my left. But before I get started on talking about my bunion that is no longer here, you need to like this video, give it a thumbs up, and comment below if you have any questions about bunion removal surgery, or anything like that for me to answer. So get to it. Okay, now we can get started. But wait, did you really do it? Did you really like, comment, and subscribe? Do it now. Now, I'm watching you. Okay, now you did it. All right, so we'll get started. So I had, like I said, I have bunions. I had a bunion on my right foot, and I have a bunion on my left foot. I had surgery on my right foot first because that bunion was more bigger than the left one, and this is how it used to look, and this is how it looks now. I still have a scar, obviously, as you can tell, but it's still, it's still fading. I put a cream that the doctor had told me to use. I don't remember the name of the cream, but I'll like show a picture or something somewhere above here. You'll see it. So yeah, so I had surgery March 18th, best day of my life. Yeah, March 18th. So this month, June 18th, will make 3 months post-op of my surgery. I'm very happy, I'm very content. I'm satisfied with the way my foot looks. So far, he cleared me to wear sandals, so that's all I've been wearing, sandals and sneakers. All right, so the day of surgery, I got there at 7 a.m. because I had to like fill out paperwork and everything like that. The surgery actually didn't take place till about 10 a.m. While I was like filling out paperwork, and then they had put like the IV in me and all that stuff, I like literally thought I was in an episode of Grey's Anatomy. But I didn't want to tell the nurses that because I didn't want them to think I was weird. But literally right after surgery, like when you're still kind of like lousy, I had to say it. And I said to the nurse, she came out with these crutches, by the way, I had no idea they were for me. And I said, "Who's that for?" She goes, "That's for you." I said, "For me?" I thought I was gonna go walk. She goes, "No, you can't walk." And I told her I literally feel like I'm in an episode of Grey's Anatomy. And she laughed, And then after that, the nurse that I had, by the way, that gave the, the IV and everything, paperwork, she was not nice. She was like the most rudest person I've ever seen in my life or met in my life. I don't know. But she was just really bad. The only nicest thing that she did was that she obviously helped me walk to my mother's car and got me in the car, and then that was it. That night I had some pain around 10, 11 o'clock before bed. I took my medicine. I had antibiotics and anti-inflammatory, and those 2 medications that I had. And that was it. And then everything else was history, pain here and there, certain days. Some days the pain was not there. Some days it was there. It was really hard at times because, as the days went by, my mom and my stepdad and my sister, although they helped me, they're not going to always 24/7 be there. So there was times that I had to sometimes kind of hop myself to the bathroom. I had to hop myself to the kitchen. And by the way, I never fell down. Except for the day before I had my, my 2-week appointment post-op, I fell. It was, when I fell, actually, what I did was my crutches slipped. So what happened was, I share a room with my sister. She's a little bit messy. She took off her clothes, put her pajamas, the clothes that she had on, she didn't put them away, and she threw them on the floor. She had asked me, because I said, "I'm going to go to the kitchen to get something." She goes, "Get me something too." As a nice big sister, Obviously, she knows that I'm hopping. But, you know, I tried my best to hold everything in place with the crutches and whatever she wanted. I made it, got to the kitchen, got the stuff. I made it right back to the room. Boom, right there. Everything falls. My crutch slips. I slam right on the floor. All I heard was a ringing in my ear. It was the most annoyingest ring ever. My mom and stepdad, thank God they were awake. They ran immediately to get me. One was carrying me on the other end. The other was carrying me on. I felt like I was a little toddler, but I didn't care because it hurt me so bad. It was really bad. By the way, you need to get an elevated pillow. That's what I had. One of my friends, shout out to Isabelli, was the only one that she was like, you need to get an elevation pillow. You need to get a laptop little desk stand. And that's what I did right before surgery. It came definitely handy. Shout out to Isabelli. Thank you so much. But yeah, so I put my foot in the elevated pillow and I was like, oh, I can't do this. I was like, I need to get out of these crutches. It was bad. It was really bad. But thankfully, when I went to the appointment the next day, nothing was bruised, nothing was damaged, everything was still in place. I have a metal in my foot, by the way. And then for the rest of my life, I feel like a robot. Like, I feel like I have like metal in my body. But yeah, so everything was fine. And back to today, I am in sneakers. It took me, like a week to walk, I think.
From the time that they saw you from your post-op.
Yeah, it took me a week.
No, you were still limping.
I was limping.
You were limping like you had surgery in your leg. We had to keep reminding her, like, dude, you didn't get surgery on your knee. Like, she would not bend the leg.
I was scared.
And honestly, the doctor kind of threatened her too. He said, listen, if you don't start walking in 7 days, your foot's going to get damaged.
Yeah, and he was like, you're going to go to physical therapy. And I was like, no. And then he said that a lot of his patients don't go to physical therapy. He's like, you're going to be one of my first. And I was like, oh, please no.
So, what did we do?
My mother kind of was she's very persistent. She was like, you're going to walk and you're going to do this. So what she did was obviously, you know, she doesn't work from home every day. So the days that she wasn't here, or even the days she was here. But anyway, she made me walk in the hallway. I live in an apartment building, so my hallway's pretty long. So she made me walk from my apartment all the way to the end of the hall with my crutches. It hurt a lot. It used to hurt me a lot to put my feet on the ground because obviously I had my foot elevated for 2 weeks. So it was hurtful, but I did it and I'm happy I did it. I'm happy that my mom pushed me through. Okay, so now I'm just going to show you some pictures of the before and after. But, sorry about that. Before I do that, did you guys really like the video? And comment and subscribe. Because you really should. So, please do that. And with that being said, I'm very content with the way my feet looks. I'm walking. I'm doing fine. Only wearing sneakers and sandals. Praying at the end of this month I can fit into some booty heels because I've been dying to wear them. I actually I didn't tell my mom this, but I tried them on. I couldn't feel my toes. They're very stiff in them, so that's how I know I'm not ready to wear them yet. So hopefully by the end of this month I'm able to feel my toes in my booty heels. But anyway, I'm getting my left foot done. Not now. You know what's funny? My doctor, when I went to my last appointment last month, I tell him I'm ready to do my next foot now. He goes, all right. Wanna do it for next month? I said, what do you mean next month? He goes, in June. I said, doctor, you just did surgery in March. No, I don't want to do it in June. And he's like, all right, well, we'll do it later on. Like, yeah, so we'll do it like in October or something. So, you know, but I'm excited. I'm ready for this change. I'm ready. So I'm very content and satisfied. So if you want to see more videos like this or see me talking more, just leave a comment for Lisa to see. I don't know if you can see, but I'm trying to push it straight. And